A'udhu billahi minasyaitanir rajim. Bismillahirrahmanirrahim. Assalamualaikum and a very good day to all our beloved medical students year 3. I hope I'm not late to wish all of you warm welcome to clinical years. Clinical years is quite challenging, but I'm really sure that all of you are prepared, and therefore we also prepare this elementary week for you guys to be adapt to the clinical years and challenges in future. I'm Dr. Shaiful Ehsan. I'm from Department of Family Medicine. I'm also in charge of the Medical Professionalism Workshop, and therefore I would like to discuss and I would like to brief regarding the things that need to be done and prepare before the workshop. I've already submitted an email to your group members, your group representative, and also your formal email address of your batch in order for you guys to understand and read the instructions as well as read on the materials so that can assist you in preparing the presentation during the workshop. So the workshop day will be on 30th October 2023, but I would like you guys to prepare the presentation and preparation beforehand. Yeah. So from this day, you've got another about 1 week plus, yeah, before 13th October, so that you can discuss with your group members regarding the tasks, understand the cases, understand the questions, and prepare the presentation in a PowerPoint. Right? So you've been divided into 4 big groups, A, B, C, and D. So this will be your group posting for major posting in year 3, which means you'll be in surgical, pediatric, internal medicine, as well as obstetric and gynecology posting, which are the 4 major posting in year 3. So based on these 4 groups, so you've been divided as well in these 4 group A, B, C, and D for this workshop day on 13th October, right? So each group will be given 2 cases. So from that cases, there will be several questions that need to be answered. So please answer the questions in a PowerPoint according to your group discussion and dynamic understanding of the answer and question. Yeah. So case number 1, present in 10 minutes. Case number 2, present in 10 minutes as well. And there is also one additional question in one of the cases that require you to prepare or to make a role play. So requires some number of characters or actors from your group in order to perform the role play. So this also should be conducted during the session in 10 minutes, right? So presentation 10 minutes, another one is the role play acting by your group members, right? So this will be fair for all groups. So all groups need to prepare 10 minutes presentation and the last 10 minutes for another 10 minutes in between for the role play, right? So total about 30 minutes plus per group, yeah, to present their work, yeah. So I also attached together with this document, other than this letter, is basically the materials for you to refer to. There are some guidelines. There are also some slide presentation, as well as some good references for you to refer to in answering the question. This could be your self-reading, right? So we will discuss during the workshop. Whenever that you present, we'll have a discussion, and I will give comments based on your answers so we can learn more during the workshop day. So even though this workshop on 13 October, and it's about 1 week plus from now, I'm hope that you can prepare since the day that you receive this document. You can also make a meeting with your group members, either online meeting, virtual meeting, or face-to-face meeting, and there will be another 1 day as a formal preparation day, which is on the 12th October, a day before Friday, so that there will be a free slot for you to discuss with your group members to prepare, to make a final preparation. Not to begin the preparation, but final preparation before the event day. Yeah? So hopefully you will be prepared beforehand, and just make some final touch up on the 12th October, on Thursday before Friday, right? So if anyone of your members or any person have problems with the task and have difficulty in understanding the task, you would like to clarify with me, you can contact me via phone number. I've already attached my phone number in the letter as well in the document that you receive, and you also can contact me through the email address. Yeah. So let us see what are the tasks. So each group will be given 2 cases. So we go to group A. So this is a case number 1 with the domain of first impression, appearance, and composure. A 35-year-old lady was admitted to the gynae ward at 3 a.m. with a complaint of a sudden onset of bleeding per vagina. So a doctor attended to her problem 1 hour after being alerted by the staff nurse in charge, and the patient was taken aback by the doctor's appearance as he looked drowsy, yawning a few times. He was just awakened from sleep after a day of busy call. He also looked unkempt. Without introducing himself to the patient and her husband, he started to ask questions. He raised his voice unnecessarily as if he's in a bad mood, being called to attend the patient in the early morning. He didn't even answer questions from the patient. He just asked questions by himself, just focused on the question by if he would like to ask from the patient. He just did his work as if he wanted to finish it quickly. He then performed the physical examination without asking permission and without the company of a nurse. He then just left the patient after giving the staff nurse in charge a few instructions without explaining to the patient and the husband regarding the condition and what other things need to be done. So the task is that please present in PowerPoint for question 1, number 4, and 1 until number 4 in the 10-minute presentation duration. And the first one is that you need to identify the unprofessional behavior shown in this case, comment on the communication skill of the doctor, describe it. How could one improve the patient-doctor relationship in this case? And what is a chaperone? And why is it necessary? And question number 5 is require you to perform a role play. So demonstrate what your group think, what would be the best approach to deal with this situation. Imagine that you are a young doctor and the patient comes to you with this complaint in the middle of the night. So how you should handle it correctly? What are the other ways that you can approach this patient? So please perform the acting in 10-minute session among your group members, right? Okay, crisis number 2 for group A is that in the domain of examining patient of a different gender. Mrs. A, a pious 30-year-old lady, came to the obstetric and gynecology clinic with a problem of infertility. She walked up to the registration counter and requested for a female doctor. Unfortunately, she was told that all the female doctors were occupied. She replied that she was willing to wait until a female doctor was available. However, the nurse told her that she had no choice but to see a medical doctor. A male doctor who had just come out of the emergency OT and looked exhausted came to attend the patient. He immediately asked the patient for her problems without prior introduction. He proceeded to ask her about her menstrual history as well as sexual history without realizing that the patient was shy and hesitant. After taking a full history, while calling out of a nurse to chaperone him, he hurriedly brought the patient to the examination couch behind the curtains. He did not wait for the chaperone to arrive before pulling down the patient's long skirt to stop the patient. The patient was shocked and immediately slapped the doctor. So your task is to present all these answers in PowerPoint presentation in 10-minute presentation. The first question, identify the unprofessional behavior shown in this case study and discuss. Number 2, discuss what you think as the best approach to handle this situation in a different way. In your opinion, would it be wise to discourage male doctors from taking up ONG? I know nowadays there are some opinions that discourage male doctors to become ONG specialists. Does it correct? What is your opinion on that? And discuss the desirable attitudes of a safe doctor that is required and what you think the best of approach to deal with this situation. I think this question number 5 is quite similar in number 2, so you can regard this. You can just concentrate on the question number 2, right? Okay, so these are the 2 cases for group A. So we go to group B. So these are the tasks for group B. Right, so we'll go to case for group B. So case number 1 with the domain of medical confidentiality. A 30-year-old newly married pilot was admitted to a general hospital for a prolonged fever. While in ward, he was extensively investigated for common infections and immune diseases. So this patient presented with prolonged fever, so we would like to know what actually the underlying problem or the underlying diagnosis or the causes for this prolonged fever. So there are some investigation need to be done, and the specialist instructed the husband to get a detailed personal history as to exclude any possibility of sexually transmitted diseases. So when you're dealing with prolonged fever, you were thinking about probably like inflammation, autoimmune disease, and sometimes sexually transmitted diseases. So the history come out that the patient had premarital sexual relationship with a few women 10 years back. So a long time ago, there is some high-risk behavior conducted by this patient. So the husband quickly informed the MO about this condition, and the MO immediately ordered an HIV test without informing or obtaining consent from the patient. So they just drew blood from the patient and sent for this HIV test. The next day, the result was ready, and it was found that the HIV status was negative. The medical officer thought it would be a good news to the patient. Without consulting the specialist, the patient was informed about the results. The patient was informed about the result during the work rounds in front of the presence of wife. The patient was shocked as he didn't know that his blood was tested for HIV in the first place, and his wife was also very suspicious about the reason why the test is conducted. And then the husband and wife had a very great quarrel, and the patient was very depressed with his wife's request of asking for divorce, and he also was furious with the medical officer whom he thought was the one to blame for the marital disharmony and planned to sue him at the hospital for this incident. All right. So your task, you need to answer question number 1 to 4 in the PowerPoint in 10 minutes presentation duration. The first question is identify the unprofessional behavior shown in this case study by the doctor, right? Second, what is medical confidentiality? State what is definition of confidentiality and identify the issue of medical confidentiality in this case. Who should order the HIV test? Is consent required for HIV testing? So what do you think? Is consent is required in performing the test? What you would do if the patient refuses the test as well? What will be your response and next action if the patient refuses for the test? And when is the best time for you to inform the patient about the HIV status, and how much information should be revealed to the patient? So what do you think about this? Okay, so that's question number 1 to number 4. Question number 5 is required your group members to perform the role play. You need to acting on this question, which means which require you guys to demonstrate what would be the best approach in informing HIV result to a patient when there are my family members or wife sitting nearby. So please conduct the role play for this question. Okay, second case is taking verbal consent. A 56-year-old man was admitted to the hospital with complaints of breathlessness, nausea, and vomiting. He has underlying diabetes, hypertension, as well as renal impairment. Following a thorough history taking and physical examination, he was diagnosed to have acute on chronic renal failure by the house officer on call. Blood investigation result revealed high blood urea, hyperkalemia with metabolic acidosis. After a review by the medical officer on call, it was decided that urgent peritoneal dialysis needed to be done that night. The house officer was asked to get consent for the procedure. The officer, though new in the medical ward attachment, had assisted a few peritoneal dialysis before. He explained to the patient that the procedure had to be done following the abnormal investigation results, in which a tube will be inserted into the abdominal cavity and kept for a few days. He also stated that usually nothing will happen. The patient appeared a bit scared, considering that there is a tube need to be inserted, and reluctant since this was the first time PD was to be done on him. Only when the medical officer after that take place, give a detailed explanation that the patient consented for the procedure to be done. So the question number 1 to number 4. Number 1, identify the unprofessional behavior that been demonstrated by the first doctor in this case. Why is consent important? And what information would you tell the patient whenever you take consent for any procedure? And how do you convince that the patient that the procedure has to be done urgently? How would you convey the message that it needs to be done urgent? And kindly state how you get consent from a patient. Example, peritoneal dialysis. So please list the things need to be included in peritoneal dialysis consent taking. So please state in this PowerPoint. So all this PowerPoint presentation in 10 minutes duration. We go to the case, we go to the group C. So the group C, the case number 1 on the domain of refusal of treatment and at own risk discharge. A 36-year-old Malay lady, a mother of 4, presented to you with a blunt history of breast lump. Upon investigation, she was diagnosed as early breast cancer and no other signs of metastasis. She was informed about the diagnosis, prognosis, and options of treatment, including operation and chemotherapy. She said that her youngest daughter is still breastfeeding. She discussed it with her husband and decided that they don't want to go with the treatment and would like to go to the other treatment pathway, which is alternative pathway, which is through the Togomo. The doctor in charge was not happy with the decision and persuaded them to reconsider the treatment proposal, which is a better option. During persuasion, the doctor showed his anger and told them that should anything happen, they should not come back to the hospital. Yeah. So these are the response of the doctor. So please answer the question in PowerPoint. Number 1, identify the unprofessional behavior in this case. Number 2, how far a doctor should tell a patient about complication and side effects of the treatment. Number 3, what is the role, spouse or close relative in decision making? If the disease progresses as a result of refusal of treatment, who should be responsible for it? Yeah. So what do you think? Is it the responsible of the doctor, the spouse, or the patient? How to balance between responsibility and treatment? Yeah. Sometimes you require some treatment to be done, but you also need to have other obligations to your family members. You also have other roles need to be completed. So which one should be the priority and how to balance this? So please answer. So the question number 5, require your group to perform a role play. You need to demonstrate what would be the best approach dealing with patient who refuses treatment. So let's say that you have a patient like this who refuses treatment. How would you counsel them to convince them not to refuse the treatment? Right? So cases number 2 is a complaint against doctors by the public. Discuss on this complaint regarding medical emergency that was brought to the attention of Ethics Committee of MMC and MMA. Yeah? Mr. A wrote, my colleagues and I witnessed an accident involving a motorbike and a lady pedestrian. My colleagues and I placed the victim in my car and drove her to the nearest clinic. Upon reaching the clinic, I asked the doctor in charge to come out to have a look at the victim. Instead of taking a look, the doctor told us that he will not take the victim in and that he will close the door of his clinic if we do not drive away. It seems to me that this doctor does not care whether this poor lady would be dead or not. For your information, the victim was not bleeding in any part of her body. Instead of debating with the doctor, we drove the victim to another clinic where the doctor took her in without question and treated her accordingly. Yeah? So your task to discuss and to state your answer in PowerPoint. Question number 1, identify the unprofessional behavior in this case. Discuss the issue of medical professionalism that is lacking in this case. Yeah, in this case. And what is the primary obligation of a medical doctor? How would you react to such situation? Let's say that a patient comes to you in an emergency case in front of your clinic. So what would be your primary obligation? Was it right, the decision to transfer this patient to another hospital instead or another clinic instead? And what do you think would be the best approach to deal with this situation? Yeah. So I think it's quite similar to the question number 3. What will you react in such situation in a better way? Yeah? So it's similar to question number 5. What would be the best approach to deal with this situation? Right? So that would be the cases for Group C. So now we go to the cases for Group D, the last group. Case number 1 is breaking bad news. Yeah. So Encik Ali, 55-year-old Malay man, come to Polyclinic Balot to get his investigation results. He was a known case of pulmonary tuberculosis in 2006 but completed treatment. He complained of coughing out blood for 2 weeks. He also noted that he had lost his appetite and weight. He also is a smoker, chronic smoker, 20 pack years. The doctor who saw him the first time ordered for chest x-ray and sputum cytology and asked him to come again a week later for the results. So as a result come out, yeah, the patient was obviously anxious about the results. And as the clinic was busy with other patients, he only got his turn to see the doctor almost an hour later. So the waiting time is quite long in clinic. And the doctor who saw the patient hurriedly repeat the report to him. So he did report the result to him in a hurried manner, yeah, and informing him that the results showing that possibility of malignancy, yeah. As the attending doctor was obviously preoccupied with trying to finish seeing other patients, he did not elaborate much about the underlying disease, yeah. Instead, he quickly wrote a referral letter to the hospital for further management of this patient. The patient, Encik Ali, was not happy with the doctor's unprofessional and non-caring attitude and decided to write a complaint in the local newspaper. On the doctor's part, he knew that he should spend time with the patient, but was so constrained with many other patients who also needed his attention at that similar time. So he has no other choice. So your task to answer question 1 until number 4, identify the unprofessional behavior. What are the shortcomings of the medical officer in breaking bad news in this case? Yeah? Will you break the bad news if you were in such a busy situation? The patient complained in the local newspaper about this attitude of the doctor. Discuss the best action that the doctor should take to address the situation in the most professional way. So what will be your reaction when someone actually complain in the local newspaper? What will be your reaction after that in order to resolve the situation? And perform a role play. This question number 5 for the role play 10 minutes for your group members to demonstrate how will you inform a bad news to a patient. Example, I give here example to reveal a lung biopsy result that confirm lung adenocarcinoma. So please conduct a role play, an act on how would you inform the result to the patient. So this is considered a breaking bad news situation. Yeah. Case number 2, abrupt behavior. So it's quite long case scenario. I hope you guys can read it, but just telling us about the inappropriate behavior of a doctor in dealing with the patient. Yeah. So after that, you can see that in this situation. So in this situation, the patient initially would like to request to see a doctor. Like say it's a Mr. A, for example, you would like to see Mr. A, but after that, found out that Mr. A is busy. So after that, another new young doctor attend the patient. But the way that he attended the patient was in hurry and just stating that patient that probably that the patient, he very confident that the patient had cancer and would need surgery. And therefore, the patient will feel not happy with this statement and still requires from Mr. A to see her and to discuss about the possible diagnosis and condition. However, Mr. A performed the discussion and conversation in a better way, and which actually relieve the patient from that unhappy moment and unhappy condition. Nevertheless, the patient did complain to Mr. A regarding what have been done or what have been informed by another doctor, the previous doctor, which is not really acceptable for her. So, and inshallah, with that, Mr. A replied that he take this complaint and will improve the situation. Right? So, the task for your group is that to identify the problems faced by the patient and the husband. Imagine that you are a surgeon. Demonstrate how would you tell Madam Z, husband, about the likelihood that she is suffering from cancer and would need surgery and chemotherapy. And the last one is important. How would you inform another doctor about his unprofessional behavior with the patient? All right. So these are the tasks. So first, identify the problems. Second, how will you demonstrate? Please state your answer on how you will demonstrate to inform the result to patient and need requires urgent treatment. And third and lastly, how will you actually inform your colleagues with his unprofessional attitude or behavior towards patient? How will you advise your other colleague about this? Yeah? So these are the tasks for each group members, and I hope that these tasks can be delivered well during the workshop day. Okay. So all of us have seen the cases just now, the case description just now. So each group will be already been given 2 cases and the questions that need to be answered. I would like to just give some introduction a bit about the medical professionalism domains that involved in these cases just now. So basically, these are the domains that involved in our discussion. Basically about the first impression by the doctor. So each time that you come to see a patient, the first impression is really important, and your impression can give information to the patient. Either the doctor is actually confident, either the doctor is caring. In reality, the patient are really looking for a very polite doctor who are really taking care of their patients, regardless of the doctor's background. They are looking for those that are very kind to them. Yeah. So your impression should be in a ready manner polite and very accurate and informative, but in a manner that is easy to be digested by the patient. Yeah, the information should be easy digested by the patient. You should be look professional, the way that you talk to the patient, the way that you appear, your dress, and so on. Yeah. Another domain also involved in the cases that we've discussed is the examining patient of different gender. So always in the situation that either a male doctor need to examine a female patient or a female doctor need to examine a male patient. So this opposite gender situation do occurs every day, and what would be the do's and don'ts that need to be observed. Yeah? So medical confidentiality. So the confidentiality actually is important, and doctor need to protect the medical confidentiality of the patient, yeah, except when the condition is actually harming the patient or the patient harming others, yeah, or others are harming the patient. So in that time, the confidentiality need to break. The doctor need to break the confidentiality and inform about the diagnosis to the other respective person. Otherwise, it's the justice for the doctor to taking care and maintain the medical confidentiality of the patient. Right? Verbal consent is really important. So other than documentation of consent, the doctor need to explain, need to give informed consent to the patient. So this considered a verbal consent. It means that you were asking for signature of the patient. Before that, you were actually informing about the procedure, about the importance of the procedure, what are the procedures that need to be undergone, what will be the expectation from this procedure, and what will be the risks and complications that might occur. Right? So these are the verbal consent that need to be performed when you're becoming a doctor, and you get patient consent before you can proceed with the procedure or any things you would like to do to your patients. So basically, either you would like to examine the patient, you also need to get a consent. When you would like to ask history from the patient, you also need to get consent. It's a verbal consent, yeah. It's show that we respect our patient and we actually respect their decision, either they would like to proceed or not. Yeah? Refusal of treatment and at all risk discharge. So sometimes you might offer help to your patient, you offer a certain kind of treatment, but sometimes if patient had other other opinions on that and would like to perform, would like to undergo any other kind of treatment modalities. So it doesn't mean that it's wrong, yeah? So you need to weigh the benefit and risk of the treatment that they choose. And sometimes you need to actually dig up further with patient, what actually their underlying reason for them to refuse our treatment, and sometimes you need to give them time, yeah, to understanding the situation, for them to get relaxed and can discuss with your family members, and please make an open door for them to come back again whenever that they change their mind. Yeah. Breaking bad news is also important, that when you're talking about breaking bad news, you are usually using your communication skills in informing a bad result to a patient who are very anxious. So there are steps on doing this. Abrupt behavior, sometimes the doctors are behaving bad to the patient and sometimes behaving bad to their colleagues as well. So these are the things that we need to improve so that we'll not fall in this abrupt behavior person. Sometimes there are complaints made by the public against the doctor because of the doctor's misconduct and misappropriate in their treatment and behavior, and sometimes it occurs because of miscommunication. Yeah, it's just a miscommunication between the patient and the doctor. So these are the domains that we can actually see that can be improved and can be discussed in this medical professionalism workshop. Yeah? So allow me to just elaborate a little bit more regarding what are the things, what will be the approach, or what will be the little bit explanation for the domains involved. Yeah. So informed consent. So when you take a consent, or when you would like to give an informed consent, would like to give information to the patient, when you would like to get consent from patient, these are the steps or the domains that should be covered in the process. Yeah. First of all, when the patient come to you or you come to the patient, assess first the ICE, ICE, the idea, the concern and expectation. What is the patient idea so far about his or her disease, his or her condition, and what happened so far to her or to him? what is his understanding about the procedure that need to be done? What are the information that he or she already know about the procedure? Yeah. So if there's something wrong about the information, you need to correct the misconception. Yeah. And what would be their concern? What are the things that they're worried of now about disease and about the procedure or anything that we like to do on her, yeah, on him? And what would be the expectation? Are they expecting you to perform A or to perform B procedure? Are they expecting you to do these things in the clinic, in the hospital? Are they expecting them to be discharged today? So you need to ask about their expectation about the things you would like to provide to her. Yeah, they're expecting that the disease is going to be resolved soon. They're expecting you to perform procedure that is not painful. So what are their expectations with regards to the disease and the procedure? So then inform her or him regarding what are the things you need to do. What is the name of the procedure and what are the steps involved, right? Each step needs to be explained to the patient in a layman term. Don't use a medical jargon, yeah? And what is the indication? Why the procedure need to be done in the first place? Why is it to be done now? Why it need to be done urgently? Well, is it because to save the patient's life? What would be the benefit that the patient could gain in a short term and also a long term sequelae pertaining to the procedure that you do? Yeah. What are the preparation need to be done for the patient before the procedure day or before the procedure time? Is the patient need to change clothes? Is the patient need to be admitted? Is the patient need to fast? Is the patient need to have some IV trips to be inserted? What are the settings need to be prepared? Yeah. Did someone need to accompany him or her? Is it to be done in the operation theater? Is it to be done in the lab room? Is it to be done in any special setting? Yeah, and explain about the step I mentioned just now, and what be the things that need to be done after the procedure. Example that the patient need to lie down for how many hours? Is the patient unable to move or the patient need to mobilize early? What do you expect? There will be some attachments on the patient body, or the patient need to be monitored with vital signs every hourly. So these are the plan that need to discuss with patient as well. And what will be the side effects of the procedure? Any procedure would have side effects. So what are the major and minor side effects? What can be done? What are the side effects that can happen intra procedure and post procedure? Yeah, and because of that possibility of side effect can happen, what are the precautions that need to be done? Example, like if it's related with bleeding, so is the patient need to have a bandage, need to have some dressing to be applied over the wound, and the patient unable to move that wound for unable to move that site for quite a long time. Is the patient required to give painkiller, for example, to avoid the pain threshold from increasing up? So what are the precautions that need to be done? And whenever that you give this information from the first domain idea, concern, expectation until the precaution or side effects, each time that you're going to go to the next topic, ask the patient, do you understand so far? Anything that you want me to repeat more? Yeah. So that whenever that you give information, there is a pause. You tell in a very slow, gentle manner that is easy to be digested by our public. Yeah, we're talking about talking the information to a non-medical personnel. So that requires some more time for them to understand about the things that you're going to deliver to them. Yeah. So these are the principles of giving informed consent, or you would like to get consent from patient. So let's say that you would like to handle a situation whereby the patient refuse treatment or refuse your management plan. Yeah. So before you say anything, identify first what are the patient backgrounds and what are their consent, expectation about the disease and the treatment. You need to empathy, yeah. You show your empathy and sympathy to the patient condition. Yeah, that actually quite they are quite in need for support, yeah, psychological and social support from you as a doctor. So don't become angry with their response. It should be empathy and show that you are concerned to their disease and their progress and to themselves as a whole. Yeah. So we treat the patient as a whole, not only the disease. Yeah. Identify possible reason. Example, previous patient bad experience or misconception about the procedure or the management. Reassess back. Okay, let's say the patient refuse. So should this procedure need to be done urgently, or do I really need the treatment to be done at this point of time, or I can give time to the patient to think? Yeah. And if it's really need to be done and patients still refuse, explain the benefits and disadvantages of the option of the treatment of your plan, and also the plan that the patient is going to do. So you show, you list, you discuss the pro and cons of each options to patient. Yeah. So your role now is to demonstrate options available, benefits of the option, and you may help patient, you may allow patient to choose, but you may guide them to a better choice. Yeah, but not forcing them. Yeah. So you need to re-educate and re-emphasize what would be the best option pertaining to the patient's condition, expectation, and background. Yeah. You might give patient time, so give some open door and follow up for your patient to come back whenever they change their mind and would like to choose your option of treatment. And always provide precautions or alternative. Let's say that the patient refuse your treatment. So let's say that patient refuse your advice. You give them a second opinion, alternative doctor, or you give them pamphlet, you give them a contact number to the other second person if they feel that they would like to have another second opinion, for example. Yeah. So these are the steps that can be included when you handling patient that refuse your treatment. Breaking bad news. So there are mnemonics. I like mnemonics. I'm sure medical students require mnemonics in order to understand and memorize some important steps. So spikes are the mnemonics of you when you're breaking bad news to the patient. So S meaning setting. So make sure that the setting and the environment is comfortable and suitable for you to discuss the bad news with your patient. It should be in a setting that is quite quiet, comfortable, possible in an area that is quite far away from busy ward rounds, or quite far away from other people. Yeah? Sometimes you require you yourself to sit down with the patient, example in a room or even in a ward rounds. It should be in the position that you are in the same eye level with the patient. Yes, so it should show that you are actually concerned. I would like to give some hint to the patient that it's something serious. Yeah. Then before you proceed, you ask patient perception so far, what he understand about the disease and the progress and the test that we taken just now. What are their perspective on the possibility of the results? And you invite them, are they ready? Are they ready to listen, to receive the information, to receive the result? Yeah. And before you give that again, you give the information, re-educate back what has happened so far, and reassess back patient understanding and knowledge so far regarding the procedure and the disease progress so far. Yeah. So reassess back their knowledge, and then you inform the results in a very you inform the result in a precise manner, meaning that you inform them precisely, but after that you pause for their response. Yeah. Inform them in a language and in a form of information that is understandable by a public, by a layman term. So you may use medical jargon in the beginning, but explain what does it mean. Yeah. So meaning example, you inform that you have a lung cancer, meaning that you have a disease that can cause damage to your lung, which can cause you to die, something like that. Yeah. So because some patients might not understand what is cancer, what is malignancy, so you tell them it's a tumor, it's an abnormal condition that actually can harmful your lung and your condition. You are at risk to get die, something like that, for them to understand what is lung cancer. Yeah. So you observe their response, their emotions, and please highlight their emotions. Yeah, be sympathy with them. You might offer them a tissue. You might offer them what is in the same danger, same gender. You can offer them to hold their hands, for example. Yeah, to give your physical support. You just touch their hand, for example. Yeah, try to make them calm, yeah, for this same gender, but opposite gender, I think it's not appropriate. Yeah, and you should maintain your professionalism, but also show your sympathy and empathy at the same time. Yeah, and if patient already calm, you may proceed with the other information, further information of the disease. And you might summarize them what are the things have been discussed just now, and what are the possible plan, what should be done after this in order to treat the condition. But let's say that your patient emotion is not stable until that end of a session, you might need to stop the discussion for a while, allow them to go in back, allow them time to be emotionally stable. They might discuss with their family members and so on, but make sure that they are safe before they return back home. Make sure that there's someone with them to accompany them, someone to send them, not themselves drive them alone, because they might in emotional distress and unable to focus in driving, for example. Yeah? So make sure that your patient is safe before you allow them to go home or to return back home. Yeah. All right, so we go to the next domain. So it's about ethical issues. If you realize that doctor job is important to doing good to patients, meaning that you are providing treatment that is beneficial to patients. So whenever that you do or you give option, you make sure that it's something that is beneficial to your patient and does not cause harm to the patient. So in medical ethics, you must always weigh the benefit and risk. So which option that is giving more benefit points to patient, and you avoid those that give more negative or more implication or complication to the patient compared to the compared to another treatment. Yeah. So you always prefer to give something that is much more heavy on the beneficial side compared to the non-beneficial side. Yeah. Compared to the maleficent side. So you are focusing on beneficence and not giving harm to the patient. Autonomy, yeah, each patient have their own autonomy to discuss, to decide what would be the best treatment for themselves. They might choose, they can choose for themselves. So we respect their autonomy, yeah. But nevertheless, our medical doctor's job should actually giving them the best treatment that is beneficial to them. So if they are choosing something that is bad, we need to re-educate them in order for them to go to the right pathway. Yeah, we give options and we give them time to decide that, and we respect their decision. That is their autonomy. We're not going to just sit there without doing nothing. We need to keep information. So that is our role in beneficence, maintaining a good outcome to patient whenever patient decided for their options for treatment, options for procedure, for example. Yeah. And justice, if you always need to be justice to your patient, as well as your resources, as well as other patient as well as to your staff. Yeah. So whenever that you need to give treatment to your patient, make sure that is it justice in terms of the fee, the price, the availability, the resources. Are you doing justice to your colleagues when you decided for that treatment? Are you doing justice for the family members and the family support when you give that treatment? Are you doing justice to your patient? Whenever that you tell a certain disease diagnosis and you offer a certain treatment, does it justice for you to do that? So always think about the appropriateness of a certain thing that you inform and the options that you give to your patients. Yeah. So these are the 4 main important elements in medical ethics that need to be upheld by all medical doctors, inshallah. Yeah. So if you're dealing with an angry patient or something that have made complaint to you, right? Let's say that it complain in front of you. So let the patient sit down and you remain calm. Yeah. Allow them to sit down first. Yeah. Whenever the patient sit down, they're able to actually control and relieve their anger faster. Yeah. And always admit that the situation has happened. You admit, yeah, the things had happened, some error have been done, and you apologize. It's okay for us to apologize, even though the mistake is not from our side. Just apologize. Apologize does not mean that you are inferior to the other party. Does not mean that you are bad. Does not mean that you are lacking knowledge. It shows that you are professional and you are good in communication with patient. Yeah. So when you apologize, the patient will become cooler and able to calm down and able to tell the story better. And you can communicate better with patient when patient calm. Yeah. So listen to the story first. Let's ventilate first. Understand their ventilation story. And once they're stable and already done with the ventilation, then you go in to discuss what is actually had happened. There could be a miscommunication from his or her side. So when you explain what happened, sometimes they realize that the mistake are from their side, so they might even apologize back to you. Yeah. If let's say that is something that have the fault is actually from your side, you already admit, you already explain, and you can offer what are the things that can be improved so that the damage can be covered, the damage can be handled or can be prevented not to be recurs in future. Yeah. So these are the things that you can practice in dealing with angry patient. So I think that's it. These are the introduction that I would like to deliver to all of you before we come to the medical professionalism workshop. I would like all of your members to prepare the tasks, and inshallah during the day of workshop on 13 October, I will start with my lecture first on medical professionalism, and after that we proceed with your group presentation. So all the best. See you guys on 13 October, and welcome to Pedagogies. Assalamu alaikum and take care.